Hi, this is Julie Lubinsky. I'm the web manager for the Christopher and Dana Reeve Foundation, and I'd like to welcome you all today for our presentation about moral distress, searching for true north, presented by Jane Barton. I'd like to tell you a little bit about Jane. She is the author of Caregiving for the Genius, and she's the founder of Cardinal LLC. And the website is cardinallife.com, which is the first slide that you're seeing on the webinar. She listens to, writes for, and speaks with patients, family members, pastoral caregivers, and healthcare providers who deal with the lived experience of serious illness, caregiving, aging, and end-of-life issues. And now I'd like to turn it over to Jane. Jane, welcome, and thank you so much for being here today.
Oh, thank you, Julie. It's certainly my pleasure to be here and to share a little bit of the afternoon with everybody that has tuned in. As Julie noted, I'm an educational consultant, and as such, I have the privilege every day to speak, write, and listen about the issues related to aging, illness, and end-of-life care, and I spend the majority of my time talking about issues related to caregiving. Now, I have a past experience of being a caregiver for my family members as well as some dear friends recently, and so I think that's probably the common ground from which we will all start from today. And our topic for discussion for the hour that we have to share is moral distress. Now, this may be a phrase that is unfamiliar to you, or maybe you've heard it but you're not exactly sure what the definition is. And that really is the focus of our conversation today, to talk about a phenomenon, a type of stress that we are all at risk of experiencing due to the ethical complexities of healthcare today. Now, usually this discussion occurs within the confines of professional settings because most of the literature is written about the impact of moral distress on healthcare providers. But I'm expanding the discussion today because family members, patients, caregivers, we are all brought into this conversation, and we are all at risk of experiencing moral distress, a type of stress that occurs when we feel as if we've compromised our values, that the moral compass within that we all have that guides us through life and helps us to make decisions about right and wrong, good and bad, has somehow been altered or perhaps even shattered by circumstances. And so it leaves us searching for true north. We are looking for that point on the horizon that's going to guide us through some of the complexities of healthcare. And so for our time today, I want us to consider several questions. And those include, what is moral distress? So we need to do some definitional work first. Once we understand what this concept means, then we need to understand how to recognize it in ourselves as well as in others, maybe our family members or our colleagues. Then the third question is, why are different perspectives important when it comes to moral distress? And we're going to recognize that we all have our own personal set of values. They're very individual, predicated on our experience, our culture, our family of origin, the society in which we live. And so we all see life uniquely. And if we only rely on our own perspective, sometimes our opinions are a bit skewed and myopic. So we need to step back and listen to the perspectives of others and perhaps have an expanded and enriched view of life and the situation. And then finally, we're going to conclude by highlighting what guides us through complex situations. What resources are available? What can we leverage that will help us to deal with the complexities that are posed by illness, by injury, by accidents, and by the progression of different conditions? What can we use for the betterment of all over the course of the journey? So let's start by naming the obvious. The journey of life is anything but linear. We know that we don't start at point A and end up at point Z in a straight line. Instead, there are twists and turns, there are ups and downs. Some we can anticipate, others are very unexpected. And sometimes when we round that corner, we are confronted by daunting situations. And the context for our discussion today is going to be about the daunting situation posed because of changes in our health status, the health status of those we love and live with, maybe extended family, and also this will include a professional perspective as well if you are a healthcare provider, whether you are a doctor, a nurse, a CNA, a chaplain, or a social worker. You are serving someone who has an issue related to either a physical or cognitive illness or condition. Now, in these daunting situations in healthcare, I think we would all recognize that over the past 50 to 75 years, the advances in healthcare have certainly outpaced our ability to comprehend the ethical implications of some of the decisions that we have to make. And sometimes those decisions are required in a very short period of time if we are in a moment of crisis or in an emergency. Now just consider your own situation, the options perhaps that some clinicians have offered to you over the past 10 or 20 years on different methods of treatment that might be available to you or a loved one. I know in my own personal experience, there are things that are available to me and to my loved ones today that my parents would never have dreamed of, much less my grandparents. And so we are moving forward in very positive ways in the advancement of medical technology and pharmacology, and those are all wonderful things. But sometimes the implications, the consequences of the implementation of some of those options, we really haven't come to terms with. So the concern is this: we can do a lot of things. Our doctor can come in and identify a myriad of plans of care and different options that we can select. We can do so many things. But the question then becomes, should we? And what does it mean if I opt to do plan A instead of plan C? What are the implications for myself, for my family, for my greater community, and maybe even society in general? Now, I think we can get a good feel for some of the hot topics in healthcare today just by highlighting a few of the more complex issues that have arisen in the past 10 to 20 years. And oftentimes we'll see these in the headline news on the internet or perhaps on the evening news. And I'm just going to run through a few of these, and then we're going to talk about some basic ethical principles that will help us in how to talk about these very complex situations. Feudal care is a very volatile and sometimes provocative phrase, because what is feudal to me may not be feudal to you. Or if I go into a hospital setting and I ask the healthcare providers to do everything for me or for my loved one, they may push back and say, well, there really is nothing to be done, and anything we would do would be futile. Well, maybe in their opinion, but not in mine. It might buy me a little bit of time that would be sacred to me. And so we're seeing that particular situation differently based on our values and also based on our objectives. Life-sustaining therapies. We have a lot of options today, again, that are relatively new. And so it is one thing to implement life-sustaining therapies. It is definitely another thing to withdraw them. And so we have to have a very intentional discussion with healthcare providers to make sure we understand the implications of initiating a plan of care, because at some point in time, we will probably have to stop it for a variety of different reasons. And then it comes to the point, well, then who makes that decision? That leads to a very complex discussion of capacity and competence. Does a patient have the ability to make their own decisions? And who determines that? Well, we can have a clinical definition of that, where a doctor can assess our capacity and competence, or we may have the courts that are brought into that particular scenario to determine if a person can make their own decisions. But we also realize with the increase in dementia in our country today that oftentimes competence is fluctuating. And so if you catch me on a good day, if I'm in an early stage of dementia, you might deem me to be competent. And maybe the next day I'm not. And so it's not black and white. It's not a simple distinction. Artificial nutrition and hydration is certainly a point of discussion for many families with their healthcare providers for a variety of different reasons. It usually comes to bear when people start having trouble swallowing, and maybe they have an increased incidence or risk of aspiration pneumonia. Now, whether a person chooses to do this or not, there are certain situations where it's advisable and where maybe it will complicate the situation as well. Palliative sedation, medical aid in dying, these are hot topics of discussion in end-of-life care for hospice and palliative care professionals. Palliative sedation is an option that is available if symptom and pain management has not responded to all other interventions. Then the option is to sedate the person to unconsciousness. Again, is that something that aligns with your values? Maybe it doesn't. Maybe it does for you, but not the rest of your family, and that can be a point of contention. Medical aid in dying, that was a hot topic in the election recently in many states. I think now 10 states have mandated legally that this would be an option for individuals to self-administer a lethal dose of a drug at the end of life. Again, that may rub you the wrong way because of your fundamental belief systems, your experience, your culture, your family of origin. And so what we are starting to establish by just highlighting this number, a small number actually, of very complex ethical situations in healthcare, is to realize there isn't a right or a wrong answer. This stage basically establishes that we are living in shades of gray. Sometimes we are living in a very foggy land, and it's hard to know what direction to choose. And so we need some principles to guide us in this ethical discourse, to tease out the information we need to make an informed decision. The basic ethical principles that come to bear in healthcare today, there are 4 primary ones that most people rely on. The first is autonomy. Now, this is the ethical principle that says I, as an individual, have the right to self-determine as long as I have capacity and competence. I can say I want certain types of healthcare interventions, and I can decline others. Non-maleficence is a principle that says healthcare providers are to do no harm to the patients they serve. And this particular principle is oftentimes contained in the Code of Ethics. Now, non-maleficence, the flip side of that, maybe rephrased, would be beneficence, to do good. Whatever the plan of care is, it's for the benefit of the patient. And then finally, justice is the 4th ethical principle that comes to bear. That has to do with allocation of resources, what is just, what is fair. Oftentimes, this goes into the discussion of rationing of health care. And so, depending on how you see life, what you value in life, you may utilize one of these principles as the primary way in which you make decisions. So, for example, a very simple example. Let's say Mr. Jones is in the hospital, and this is his 6th trip to the hospital for aspiration pneumonia in the last 2 years. Now, his doctor comes in to talk to him, and he's very concerned about this. He said, now, Mr. Jones, I know we've had this discussion before, but I think now is the time for us to seriously consider a feeding tube because the risk of pneumonia is too great for you. This last experience was life-threatening. He said, I don't want you to take that risk again. And Mr. Jones listens to this. The doctor is presenting this plan of care predicated on the principle of beneficence, to do good for his patient. And Mr. Jones listens to this argument and listens to the plan of care, and he said, you know, Doc, I totally understand what you're saying. I understand the risk. But here's the deal. I love to eat, and it's one of the few sensory pleasures I still have. And so I'm going to continue to eat. I'm going to enjoy my coffee in the morning with my wife. I'm going to have a steak from time to time, and I'm going to enjoy a hot fudge sundae on Sunday afternoons. And I know the risk that I'm taking. Now, he has the right to do that. Now, I'm not saying that the doctor is right and the patient is wrong. I'm not saying anybody's right or wrong here. What I'm saying is this highlights the nature of ethical discourse today in healthcare. We are so often dealing with competing goods predicated on our viewpoint. The good for Mr. Jones, in his opinion, was pleasure. He wanted to savor some delicious food and to continue to do so. The competing good for the doctor was he wanted to reduce the risk of pneumonia for his patient. He wanted to make sure his patient was safe. So how do you make that choice? Well, it comes down to values. And the values oftentimes are competing, and in those discussions, we can start to feel confused. We feel uncertain and perplexed and bewildered, disoriented, unclear which way to go, and we get frustrated. And if we start to have the idea that we are the only person in the room that is right, that's when we start to have arguments that can be divisive within a family, between the healthcare providers and family members, and we don't want to go there. We need to understand that these situations weigh heavy on everybody involved, healthcare providers, the patient, the family caregivers, and also the related family and friends. And so this weighing down, it's a difficult balancing act because we're all trying to figure out which way to go. We're trying to honor our own values to come together to make the best decision. But we are at risk of feeling morally distressed if we feel as if we have not been heard perhaps, or we're not on board with the ultimate decision. So the doctor in that simple scenario that I expressed to you, he could have left that room feeling morally distressed. Not necessarily, but he could have. If he felt that his patient was making an uninformed or ill-informed decision, it could have worn on his heart and his soul, and he could have carried that stress with him. And that is the definition of moral distress. It is rooted in an ethical conflict. And we have the feeling we have an inability to do the right thing. And so the doctor, when leaving Mr. Jones, could have felt as if he had not performed his job to the utmost, that he had not been beneficent to his patient. Wendy Austin, who writes extensively about moral distress, says, it is experience when we believe we know how we should act, know what is the right thing to do, but find we cannot do it. We have failed in some way in fully meeting our moral obligations. This sense of failure can reshape the image we have of ourselves as capable, good, and upright persons. Unresolved moral distress can have lasting effects on a person in the form of physical, emotional, and spiritual consequences. So this is important to understand and to recognize, because if it goes unrecognized and unmitigated, it can really begin to have some serious consequences, which we will highlight shortly. So just like the doctor in that brief little scenario, we want to do the right thing. But if we feel morally distressed, we feel as if our hands are tied. We can't make it happen, just like the doctor couldn't. Mr. Jones had the right to say no. So in the definition of moral distress, you may be sitting there wondering, the right thing? Well, we've already said oftentimes we're dealing with shades of gray and competing goods. But sometimes we as an individual, we believe we know the right thing to do. That's when we get convicted about a particular plan of care. And the right thing for us is the plan, the action that aligns with our values. We feel like we're on track. We feel like we're going in the right direction. For me, I know when the action is aligned with my values because my gut tells me. My gut is my moral compass. When I feel at peace, when I feel calm, when my gut is good, I know I'm going in the right way. And you may have a similar thing that you use that kind of helps you orient with life. But in those moments, we feel as if we know exactly how the path should unfold. But the reality is this. Sometimes we are not in control of every decision. And in those moments, we have to realize sometimes our way, our right way, is not an option. And in those moments, which are not pleasant to experience, we feel as if we've been pulled off course. That's when we feel morally distressed. Our moral compass has now shifted off of true north. And we feel constrained, we feel conflicted, and we feel confused. Now you may be wondering, well, what can constrain us? Well, there are a variety of things. Let's talk about internal constraints first. Let's say you're dealing, again, with a similar situation to the doctor and Mr. Jones. Internal constraints, if you were part of that conversation, perhaps you have a lack of confidence and you don't voice your opinion. Perhaps you're the adult child of Mr. Jones. You don't really understand artificial nutrition and hydration, so you have some self-doubt. Perhaps you don't want to have any conflict with your father. And so he's saying no, And he's always been the decision maker in your family, so you have a concern for that relationship more than the plan of care. And so perhaps you don't dial into that conversation and you don't articulate it. But then maybe a week or 2 weeks down the road, you start to reflect on it and you wonder, wow, I wish I'd said something. So we have internal constraints. We also have external or systemic constraints. Power imbalances. Now those can be between professionals. A lot has been written about moral distress due to the power imbalance between doctors and nurses. But we also have a power imbalance sometimes between doctors and patients, or between siblings in a family, or between parents and adult children. So again, it's not just within the professional realm, it can also dial into the family system. Poor communication certainly can be a constraint, not having all the information or understanding the position of everybody involved. Legal mandates. We have to recognize that perhaps there is some plan of care that an individual wants that is not legal. That would go to the medical aid in dying. If you don't live in a state, one of the 10 states that have legalized this particular option at end of life, this is not an option that you should consider because you can have some legal implications. Family dynamics, again, we've talked about that, the power imbalances between different roles. And you may feel as if you have a lack of authority to inform and influence a particular situation. Let's say Mr. Jones is deemed to be incompetent and not able to make his own decisions about the feeding tube. Well, maybe he has already designated a healthcare agent and it's not you. So you would not have the power, again, to honor his wishes, hopefully. Maybe that has been delegated to another sibling or perhaps the wife, your mother. So lack of authority can also dial into constraints. So there are a variety of things that can leave us feeling helpless and hopeless and impotent to do anything to change the reality of the situation. Now, I think a little historical background on how this topic came to be and this point of discussion and research over the last 30 years. And I think it will give you, a basis to understand the importance of this topic as well. This term was first coined in 1984 by a gentleman who wrote a book for nurses, a textbook. And in this initial textbook, he defined the term moral distress, and he highlighted the issue for clinicians only, specific to nurses. Now, if you look at the bibliography that's associated with this webinar, you'll note that even today, the majority of research and literature published on moral distress comes from the nursing community. And that really makes sense when you understand what moral distress is. Nurses are in the trenches with families oftentimes. They are providing intimate care, and they're the go-between between the doctor and the family. And oftentimes they are caught in the middle. They're in the squeeze, being the advocate for the patient and the family and trying to implement the orders of the doctor. And if everybody is not on the same page, oftentimes nurses are the ones that really start to feel moral distress. It was recognized in the 80s, the high attrition rate in the nursing community in acute care settings, such as the emergency room, the ICU, and cardiac care. And the turnover rate was sometimes 30 to 40%. And when this was studied specifically, oftentimes it was because nurses felt morally distressed and they felt helpless to do the right thing, so they left their jobs. Well, that is still important today, but it's important to recognize that families confront moral dilemmas and morally distressing situations as well. They're part of the conversation, and they are at risk of feeling as if their values have been compromised and perhaps their voice is not heard. Now, a moral dilemma, as we know, a dilemma, there is no right or wrong by definition. And so families are brought into these discussions where there is no obvious right or wrong, good or bad direction to go. And so that's when we start to feel conflicted. That's when we get confused. So let's bring this all together, pull all these different ideas and concepts together in a story. because I think we learn best through a story. And I want you to consider a couple that's been married for 40 years, over 40 years actually. They're both professionals. They have a great life, very active in the community. Both exercise on a daily basis. They have their children. The children are grown. They're married. They have their own careers and families, and life is moving along. And then one day, a life-changing moment occurs. The gentleman awakens one morning, just like he always does, goes out, gets on his bike, and he goes for his morning ride. And on the way home from that ride, coming down the mountains, heading home, he rounds a blind curve, crashes into another cyclist head-on, flies over the handlebars, lands on his head, and breaks his neck. And life is changed forever for this gentleman, for his wife, for their family, for their friends, and also for the healthcare providers that assisted them in the years after the accident. Now, this life-changing moment initiated a series of difficult questions, ethically complex questions, for the healthcare providers as well as for the family members. The first 2 years, the family had to adjust to the situation of quadriplegia. They had to understand what they needed to learn and the changes they needed to make in their living conditions. Following the first 2 years, then they were dealing with some of the other complications associated with quadriplegia, such as urinary tract infections that were very common. As they moved along, as the condition progressed, they also had to consider a cardio pacemaker. They looked at a diaphragm pacer. They had to consider supplemental oxygen, the implementation of a ventilator, and ultimately a feeding tube. And with all of these different questions and turning points in the condition of the gentleman, there were numerous options that were identified for them. And in the discussions at the end of all of these things, considering the next step, they were always wondering which way to go, what would be the best option. And the gentleman obviously was involved in the conversation. The wife, the children, the supportive family and community. Each situation was bewildering to not all of them, but to a select few of them, and it would kind of shift around the room. They would all see the situation differently, wondering what is the better option in that moment. And for each question that came up, each decision potentially was morally distressing for someone in the room. Now, the reason I highlight this is that for all of us, when we have a life-changing event, it precipitates this progression, the falling of the dominoes, and it's usually not just one perplexing question. It will be a series of questions, a series of changes with subsequent transitions, all of which could be morally distressing based on your values, based on your own particular true north. And if we don't understand what moral distress is and we don't address it, it can leave a lasting residue, something that we just don't wash off if we don't understand it. And a moral residue builds up over time. It lingers, it weighs, it's heavy on our hearts, our minds, and our spirits. Just because we don't understand it, it doesn't mean it goes away. We can't just ignore it and turn a blind eye to it, because moral distress will build up over time as all these incidents continue to stack one upon another. This particular situation is referred to in the literature as moral residue crescendo. And it's just like a crescendo in a song. You may hear a very soft melody initially, and then as the crescendo builds in music, it becomes the dominant sound that you hear. You can't ignore it. And the same is true for a moral residue crescendo. From the initial question, the initial perplexing, ethically complex situation, you may feel kind of a twinge in your stomach, that little knot that tells you, oh man, my moral compass is not pointing to true north right now. And then over time, repeated incidents it will be screaming in your ear saying something is wrong. So with time, repeated incidents, the crescendo builds and care is required. So we can't ignore it. The danger of ignoring moral distress is real and it is significant. If we ignore it, we risk becoming morally numb. And we flatline basically, emotionally. And so we can think of it as unplugging, disconnecting, and merely going through the motions. But we're really not invested in life anymore. Now, from a professional as well as a personal perspective, this can also lead to actions that are quite inappropriate. Now, it's a silly image, but it's meant to kind of soften our discussion. But this can be very offensive, certainly from a professional, but it can be very disruptive in families as well. And to the extreme, if we don't address moral distress and it continues to build, we will ultimately check out, just like I alluded to with the nurses and the increased attrition rate professionally. They would leave the profession or they would change jobs. In the family setting, it might lead to a separation of a relationship, saying, I can't do this anymore, I'm out of here. So we don't want it to go to that extreme. Instead, we want to understand it by defining it and learn how to recognize it and ultimately how to address it. Our challenge isn't to eliminate moral distress because we can't. It is becoming part of our new normal, and it's not going away. So our new goals have become learning how to recognize and address it effectively. And in order to do that, we need to understand what signs point to moral distress in ourselves and in the people we live with and the people that we work with, and also perhaps for the people that serve us. Because if you are listening in as a family member, a care receiver, or a caregiver, you may recognize some of the signs of moral distress in the healthcare providers that are serving you. Perhaps you can be a mentor and an educator to them after this program today. So what signs point to moral distress? Well, I think the first and I think the most obvious one is we feel conflicted. We feel literally twisted inside. And as I mentioned earlier, my gut is my moral compass. So if I feel like there is a knot in my stomach, that means to me that I'm off course. I'm no longer honoring and aligned with my values. Some people will say, I feel irritated, ruffled feathers all the time. I'm never calm. I'm always kind of anxious. Some folks become confrontational, and this confrontation is a way to express what ultimately is their anger about the situation. Now, if you're like most people, you don't deal really well with anger from yourself or from others. But anger actually is a fabulous sign of something else. There's always another emotion that drives our rage. And for moral distress, it's our helplessness, our hopelessness, our frustration with the situation, and inability to determine what we should be doing. For some people with moral distress, they become depressed. They start to isolate, withdraw. And this can go to the point of clinical depression where professional help and maybe even medications are required. Some people will become overly emotional to the extremes, either crying, maybe hysterical laughing. Whatever it might be, it's an aberration from the norm. Now, all of these manifestations of moral distress can lead to frequent medical issues because stress, this type of stress, like any other kind of stress, will compromise our immune system. And so we are much more at risk of infections and other conditions that could ultimately be life-threatening. And finally, change in sleep habits. In fact, this may be one of the first signs you have that you are morally distressed because you go to bed wrestling internally with what is going on. And you're trying to figure out why you feel so disoriented, so out of kilter, discombobulated. You just don't feel like you have your bearings in life, only because you don't. So you may not sleep at all, again, a deviation from the norm, or you may want to escape everything and sleep all the time. So look at either extreme to see if something's going on. So suffice it to say, if you feel defeated, if you feel deflated, if you feel diminished, I would suggest that it's time to get your bearings, to do a little double check to see, are you aligned with your values? And if not, then it's time to realign with your true north, to make sure you match up your values with your goals. Now, in order to do that, it's always good to do some self-reflection, to really understand who you are and what you are about and what you believe to be true. This always brings to mind the quote from Hamlet for me: "This above all, to thine own self be true, and it must follow as the night the day. Thou canst not then be false to any man." If we know who we are and what we are about and what we believe to be true, we can't be false to anyone else. And so know thyself, that's the beginning point for everything in life, right? Now we also need to be very sensitive to the fact that our true north is uniquely ours. And it's not for me to convince you to go in the same direction as mine, because you won't. We all have our own position and direction in life predicated on our own unique view of life. And that view is informed by influential elements such as our knowledge, our cultural norms, our age, our gender, our role, our experiences in life, and our spiritual beliefs. That is the lens through which I look at life, and I bring things into focus. And it is a unique view for me. So it's not to say I have to convince you to see life as I do. I just need to understand what my view is like, and perhaps I can share mine with you. But it also brings to mind that what brings me moral distress or causes me moral distress may not bother you in the same way, because you have different values, you have a different perspective. Now this is important to recognize, because I've listened to many families dealing with an ethically complex situation. And there might be one person in that particular scenario that is very distressed by the situation. And everybody else in the room is okay with either plan A or plan B. They could live with either one. And the one person that's morally distressed doesn't understand why no one else is as upset as they are. It's because they see the situation differently. It's not to say it's right or wrong, but it's different. So we need to remember that our individual view is always limited. We have a very myopic view of life, and our view is only one piece of the bigger picture. So we benefit by listening to other people and hearing what they're seeing, understanding what their perspective is, and how they understand the situation. So I want to take you through a very simple example of how taking into consideration the perspective of others can actually allow us to see the bigger picture. So I want you to imagine that you and your family are lined up in front of a wall. And on the other side of this wall is a beautiful vista of nature. Now, predicated on where you are in proximity to that wall, you have one little window on the world. It could be high, low, left, or right, but you only get to look at this scene through one pane of that window. So, for example, let's say you're the caregiver in your family, and you are at the wall, and you get this view of the bigger vista out there. And you start to talk to your family, and you say, well, it's blue. I'm not sure if it's sky or if it's water. And then the person that you're caring for is next to you, and they say, what are you talking about? I don't see anything blue. In fact, I'm not quite sure what I'm looking at, but there's a lot of gray in it. The doctor that cares for your loved one came by to visit. He's looking out this same window, and he goes, wow, well, my view's totally different. I'm seeing a lot of pine trees. I see sky, but there are a lot of pine trees. And then your adult children are there and saying, what are you, pine trees? I think we're looking at aspen trees, and it looks like a very fallish scene. You have a friend that also is standing there, and they're like, well, gosh, I get to see all of this. I have sky, I have aspens, I have pine trees, I even see some mountains. And then you have some other friends that kind of cruise by the community view, and they're saying, well, I don't know what you guys are looking at, but it looks like everything is upside down in our view. Now, as you all compare your different perspectives on the same scene, that is when the complete picture comes to bear. And as you compare notes, you realize, oh my gosh, we are standing at the base of the Maroon Bells, an iconic place close to Aspen, Colorado. But if you had relied solely on your own perspective, your limited view, you never would have known that. You never would have realized that. This is a wonderful lesson to learn when we are in ethically complex situations. We need other people's perspectives. In fact, relying solely on our unique perspective of a situation is truly unwise. It's limiting. So what we need to do is gather around. We need to bring family and friends and clinicians in. We need to share our point of view. And we need to appreciate the perspective of others, to honor it, not to argue it, certainly to discuss it. But it's not about being right or wrong. It's working together for the betterment of all. So in this collaboration, what can guide us and help us so that all persons feel as if we are honoring our values and we are moving in the right direction? Well, first and foremost, we need to remember our boundaries, personal as well as professional. What are the role expectations? And so we keep it between the lines. Know what is yours to own and what is not. Invite collaborative souls into the process, people that want to be part of the discussion. Again, not turf wars, not trying to claim that they're right, but to discuss the merits of all perspectives. We also need knowledge to make informed decisions. That knowledge may be derived from people in your family, from the healthcare professionals that are serving you, or perhaps from other people who have walked a similar path. They have the experience of the lived experience. This can be vitally important. We also, in this process, need to create a safe environment where all persons are heard. Whether it's around the kitchen table, in your doctor's office, sitting outside in the sun, wherever it is, have that posture of an open mind and an open heart that will invite people to share and to debate and to discuss and hopefully move toward common ground. And if needed, certainly seek wise counsel. Again, that may be a clinician, could be a mediator or an arbitrator that your family can benefit from, a pastoral care provider, someone that can lead you in a direction where everyone feels honored and on track. Now, the dividends of addressing moral distress are many. So we'll just highlight a few, and then we will wrap up and have some time for some questions. But first and foremost, by addressing, confronting, and having the courage to face this particular type of stress, we name the elephant in the room. We name it, and that is the first step in addressing it and then mitigating it. We have to stop dancing around the issue. And that's easy to do when there's so many other things to do when it comes to maybe a crisis in health care. But we have to slow down, to sit back, and to address that concern so that we can mitigate the stress that is going to be present in the home. We also want to honor every person. And if we address moral distress, if we create that safe environment, if we invite people to offer different perspectives, everyone will feel honored and part of that process because we are taking the time to listen to each other. And we listen to not only what is said, but we also take the time to listen between the lines. We listen for what is not said, and sometimes that is equally, if not more important. We also recognize that moral distress is a universal concern and issue. We normalize it. So it's not something that we point out in another person in a diminishing way. We're all at risk of feeling moral distress. And so we are all wise to recognize it and to help each other through this experience. And by addressing it, we reduce the crescendo of the moral residue, layer after layer that builds up, incident after incident, that has the potential to wear us out and to hold us down. So a few final directions in dealing with moral distress when we are searching for true north. First and foremost, you need to know your true north. That takes time and intention to sit back and identify your own personal values. To thine own self be true. So take the time to do that. Have a cup of coffee. Talk to a dear friend. Have some silence so that you can determine, okay, when did I start feeling this way? How can I get back on track? What will be required for me to feel as if I'm living with integrity again? Recognize the signs of moral distress in yourself and in others. And don't be frightened by them, but instead, when recognized, proactively confront moral distress. Not in a punitive way, but in a very proactive, life-giving way. Additionally, seek and value different perspectives. Take a poll of family members. Talk to the clinicians that are serving you. Talk to friends. Talk to people who have been in a similar situation that you are currently. And don't judge, don't diminish. Consider thoughtfully and understand how other perspectives can inform and influence the choices and the decisions that you will make. And have the desire to work together, to work with others, again for the greater good. And ultimately, trust that you will find your way back to true north. There are going to be many occasions when you feel as if you are being pulled off course, and you have the ability to adjust, to accommodate, to realign. And you don't have to do it all at once. This is a process that happens one step at a time. And as we do this, we are able to see and recognize that hope is still on the horizon. A good thing indeed. So I want to thank you for your time and attention today. And I'd like to turn this back to Julie because I think we certainly have time to have some comments and questions and maybe some discussion.
Yeah, so operator, reader, we are ready to go with the question and answers. If you would please open the line.
At this time, if you would like to ask a question, please press star 1 on your telephone keypad. That is star 1.
And you may also, if you have a question, you may also use this chat box to type it in. What a wonderful presentation, Jane. Thank you so much for your time today.
Absolutely, my pleasure.
I'm just going to give people a little bit of time if they have a question to type it in or if they want to press star 1 on their telephone.
And we have a question from the line of Maria Edwards.
Sure, please put her through.
Good afternoon. Can you hear me?
Yes.
My question is simply, I absolutely first totally enjoyed Jane's presentation. I'm wondering if there's a way that we can receive a written transcript of this conversation.
We do have, this is Julie, we have recorded this and we're making it available for all those who registered. So you'll be able to view it again.
Oh, great. Thank you.
Sure. Is there anything else we can help you with, Maria?
There are no further questions at this time.
All right. Thank you. We'll give just another minute if there's somebody. Jane, if you can look in the chat box. Susan has a question.
Right. Hang on. I'm scrolling over here.
Sure. No problem. And if you would, if you mind reading it out loud, because not everybody can see it.
Okay, this is from a woman by the name of Susan. This presentation dealt more with situations in which a decision has to be made. However, the claustrophobic feeling of dealing with significantly disabled family members on a day-to-day basis does not necessarily deal with a decision. Friends and family are not in our situation, and while they want to be helpful, they don't, quote unquote, get it. What can we do in this situation? Well, Susan, I certainly appreciate your question, and I can't say I know exactly how you feel because I'm not in your situation. But having been a caregiver, I have great empathy for the sentiment expressed. And I'm not sure that what you're describing is actually moral distress, although sometimes that's hard to discern with limited information. But I think also a situation, another type of stress that I sense kind of in between your writing is compassion fatigue. And this is a stress that's related to the over-identification or overexposure to the suffering of another person. And that can be a loved one. It could also be in the relationship between a professional and also people that are served on a client or patient basis. So I think what you can do in this situation is to recognize that I know you are fully occupied with the care of your loved one, but you have to find time to take care of yourself as well. You have to find a little crack in the day in which it's all about you, and that's not being selfish. November is actually National Family Caregiver Month, and the theme this year was Take Care to Give Care. And I love that sentiment because if we as care providers don't care for ourselves, we are not going to be able to care for our loved ones. So I have a quick little way to start this, hopefully, ritual of self-care on a routine basis for you. And I learned this from a caregiver in the trenches. She taught me so much because she was caring for her husband, her son, and her mother, and also working full-time. And she said she had a 5-minute plan. And for 5 minutes every day, she listened to music in the privacy of her bathroom because that was the only room that locked in her house. And she said that 5 minutes was her saving grace every day because she didn't think about anybody else but herself. And so I challenged her after she shared with me that wonderful ritual to increase it to 10 minutes because I reflected back to her she was worth 10 minutes. And so over the years I've bumped into her at various conferences, and now she's up to 15 minutes a day, and I'm quite proud of her for doing that. But the point being, don't think that self-care is not possible because you don't have an hour a day. Start with 5 minutes and be committed to that. And then hopefully you can extend that to longer periods of time.
Thanks, Jane. I just want to check if there's any other audio questions.
There are no questions at this time.
Okay. I'm going close to 4, so there's Deborah has typed something in for you. Thank you, Deborah.
Okay, you want me to read this out loud, Julie?
Yes, please.
Okay. So this is from Deborah. She said, thank you so much for this. I've been dealing with this issue for years as a caregiver and support group facilitator. I've recently begun counseling, and these issues are ones we've started discussing. The difficulty of being unable to solve all of the issues caregivers have is so distressing, and learning that just listening and caring for them is enough. Oh my gosh, Deborah, you are a wise woman indeed. Listening is certainly underrated in our society. In fact, as I worked in hospice for many years as a chaplain, oftentimes the only thing I could offer to people that I served was my willingness and my ability to sit and to listen, because I certainly had no answers. And sometimes that's really all we do need, is just someone that has a caring, compassionate, and willing heart, without judging, without trying to fix it or change our reality, just to be witness to our suffering. And that takes a tremendous amount of courage. So thank you for mentioning that.
Thanks, Deborah, for your response. Not so much a question, but it is a good response. And Jane, thank you for your time today. I'd like to just put one more call to see if there's any audio questions.
There are no further audio questions at this time.
Okay, and I don't see any more chat questions. So Jane, I'd like to thank you for joining us today and letting us all in on this wonderful topic of caregiving. And your presentation was so wonderful and so delightful to even visually as well. So thank you for your time today, and I want to thank everybody else for joining us on the call today.
Certainly my pleasure, and I wish all of you a blessed holiday season. And
Jane's information is up on the slide on the webinar, but please visit her site, cardinallife.com, and there's a ton of information that you can get off of her website, and she also left her email in case you need to contact her. Thank you,
Absolutely.
everybody. Have a good day.
Take care. Bye-bye.
All right. Thanks, Jane.
Bye-bye.
This concludes today's conference call. You may now disconnect your lines.